Good evening, everyone. Welcome to the Lipedema Canada Fireside Chat. Um, my name is Emma Cloney. I am the current president of Lipedema Canada. When last we spoke, I was sitting in the vice president role. We're so grateful that we could all get together tonight and find the time to really do this important work. And one of the reasons that we wanted to host this chat was, frankly, we'd seen some comments in our social media about what Lipedema Canada is or isn't doing or should be doing or things you guys wish that we were doing. And the reality is that we have been so unbelievably busy doing the work that we might have fallen behind on the keeping you up to date part. So this is an amazing opportunity as we are in December of another year of Lipedema Canada and incredible work for us to basically come together and give you the update and tell you what we've been working on and tell you what your work has led to and what is coming forward in 2026. So I'm very excited to introduce you through our festive set and our festive team to the Lipedema Canada directing team. So let's head over there. Hello, everybody.
Hi.
Hi.
Hello.
Lovely to see all of you. So like I was saying to the folks at the top of the intro, this has been a year of unprecedented action for our community. We have worked tirelessly, as you all know, to create resources to help navigate life with lipedema. Every time we see a problem come up in the community, we're immediately working on a strategy on how we could help. We've ensured all of you world travelers, does everyone have their suitcases unpacked yet or repacked, as it is that we are again leaving tomorrow? But we have engaged in conferences and presentations in 2025. Let's see, we did Atlanta, Georgia. We had Montreal for Obesity Canada. We had Calgary for Lymphecon. Niagara Falls for the International Lymphedema Framework, and then Rome for the World Lipedema Congress. And then next week, Angel and I are headed off to Montreal to go and meet with other associations in the area and clinicians in the area. That's just the short list. So why don't we go ahead and introduce the team? So everyone knows who I am. Again, Emma from Lipedema Canada. And I'm going to pass it over to Angel. Angel, can you tell them all about yourself, your role, and one interesting fact about you?
What about your interesting fact first?
Oh, my interesting fact.
Or
My
you can come at the
interesting
end.
fact. Yeah, let me think on mine because
Okay.
let me think on it. You go ahead.
Okay, for sure. Hi, I'm Angel Anderson. I'm Vice President and Treasurer of Lipedema Canada and one of the original founders. I live in Winnipeg. And my random fact is I become an accidental vintage gold collector and sometimes seller. Holly?
Holly Head, Director of Communications. I am originally from Newfoundland, and my new favorite passion is my puppy, who's 7 months old. Helen?
Hi, my name is Helen Papadolias. I'm physically located in Toronto and I'm the secretary for Lipedema Canada. My interesting fact is I'm an avid baker and I really just do it for fun. I go to baking school in addition to the multiple tasks that I have under Lipedema Canada.
Hi, I'm Raina Zapp. I'm a director with Lipedema Canada. I live in BC, and though I always have a great manicure, my hands in dirt are what fills my heart. So, yeah. So I wanted to introduce two new faces we have. First, Jess Erzinger. Jess is a new board member to us, and we're very excited to have her. Jess is a retired respiratory therapist, but has many, many years in clinical leadership, program design, a patient advocate and educator. And she brings lots of energy as a new lipedema patient and embarking on her own journey. And we're super excited to have her join us. So over to Jess, and then I'll introduce our next person.
Thank you, Raina. My name is Jess Erzinger. I live on Southern Vancouver Island. I'm very, very excited to be a new member on this board. I'm working with this fantastic team. I am currently General Director, and we'll see where that role evolves over time. Excited to find that out. And a fun fact about me is I absolutely love white Christmas lights. Everybody's all about the multicolored, but I love the white.
Super. Thanks, Jess. Okay, and then hot off the presses, Dr. Delphine Bourry-Simon is, I hope I said that correctly, is our newest Director of Clinical Education and Medical Co-Chair. She is a family physician in physician and family medicine, specializing in venous and lymphatic medicine. So Delphine, please introduce yourself to the group. Welcome.
Oh, Delphine, we can't hear you. I'm not sure if you have muted.
No.
That's okay. Delphine, I'll let you work on the audio there real quick and just figure out if there's anything we can do, and then we will come right back to you for intro. So
Emma, your fun fact?
My fun fact.
Can you
My
hear
fun.
me?
Yes, go ahead, Delphine. Yes, please tell us about yourself.
Okay, I'm really sorry about that. Some
Not at all.
technical issues. So yes, I'm Delphine Bourry. I'm a family physician. I live in the South Shore of Montreal. Sorry, I'm usually better with the computer. And
It's okay.
I'm really happy. I have joined the board of Lipedema Canada very recently. I'm really trying my best to help out my patients. So I don't have lipedema myself, but I see maybe 20 lipedema patients a week, and I've been doing that for the past 3 years. So I'm very happy I can actually do something to help my patients and my future patients and every woman who actually suffers from this disease. And so what I will try to do is to provide some guidance and help to navigate some of the medical system in Canada, especially in Quebec, and also help all the, like we're speaking English in the beginning, but I'm actually from France, so I speak French. And I will try also to provide some maybe documentation and some help and some education in both languages.
Fantastic.
Perfect. And I think maybe just a quick reminder, so Delphine and I both speak French, so if anyone has any French questions, please feel free to write them in the chat in French, and one of us will be able to assist.
And after the live stream, for those of us who are joining us and we're wishing that we were closed captioned in French, afterward we are able to translate it, but we don't currently have the technology to translate it in real time. So please know that it is something we are working on, but haven't figured out how to solve just yet. My fun fact, fast fact, would be that I am one of the Jill of all trades. I usually don't maintain an activity that I am not good at, but that's not to say that there aren't things that I'm not good at. Being patient, stopping shopping, or not falling in love with whatever addiction Angel has become most recently attached to seems to be the fun fact for the year for me. I'm working very hard on not becoming obsessed with gold like Angel because she shares a lot and I love that. But we need to be more practical in 2026.
It's an investment, really. Yeah.
See, she's not helping. She's not. All right. So we want to make sure we get to all of the great updates that we have. So thank you all for introducing yourselves. It is very exciting to have our new directors here with us, and including Dr. Bourry-Simon, who comes to us as the first director in our history to not have lipedema to join the board. And so it's a very special position to be in a trusted position, to be welcomed into a board that we know that you would act as any of us would from the advocacy standpoint of people who understand what it's like to live with the disease. So we're so excited to have you and Jess here, and more announcements to come shortly. So let's talk about some of the things that we have actually done. I made a slide. Can we go to the slide? Let's go to the reel. This is Lipedema Canada's year in review. So just looking in 2025, we wanted a way to kind of show you guys what we have actually done. So I'll start us off here. The first line that you see at the top, number of volunteer hours. This is the cumulative total of the volunteer hours of the Board of Lipedema Canada and our auxiliary volunteers, which includes the folks that help us run our social media, the people that help us enter our provider database, and the ones who have different positions, whether it's helping us in Alberta with special projects. We have a great team of volunteers who we rely on heavily, and we have put in a total of 9,450 approximate volunteer hours as a team in 2025. Angel, as the treasurer, why don't you do the next one?
Yeah, I'm just newly back in the treasurer role, but we have raised $9,090 over the year of 2025. So that includes donations from our supporters and then also from our sponsors.
Amazing. Holly, why don't you grab the next one?
What are we looking at? The website? Monthly website.
Website.
I'm just keeping an eye on our time, people. I just want to keep an eye on our time.
All right, let's move right through it.
Yes. So we're at 7,800 for the monthly website visitors.
That's pretty good. When you average that out, the numbers actually were over 1 million visits in 2025. Our website is one of the most visited websites for lipedema information in the world, actually. So we're very proud of that, and we are so excited to put up new resources and give it a facelift. Helen, next one.
Oh, those brochures. We've mailed out over 6,400 brochures or have given 6,400 brochures throughout the year, and that's both in French and in English.
And all of those have been at no cost to anyone. That's what we use the donations for, is to make sure we can put resources in people's hands. Hey, Rena, do you want to talk about the clinicians educated portion?
Okay, support groups members 3,900, clinicians educated. That's okay. Clinicians educated 2,641. Very keen, very interested clinicians now have a lot more information about lipedema than they did before.
Excellent. And then we've had some surveys go out. So we did surveys on compression, we did surveys on pain. We've had 2,400 respondents to those surveys, and those are helping inform policy decisions and figuring out what advocacy points need to happen next. Back to Holly for subscribers.
Yeah, we've got our 1950 subscribers to our newsletter, and we're going to be putting out additional newsletters, more newsletters for the new year to come.
Awesome. And I'll run through the last ones quickly. So we respond to a lot of emails in our inbox. Predominantly, it's Holly as the Director of Communications. We've also reached out and handled phone calls, and we try to be there for our members wherever possible. 225 emails and calls and meetings were set just with members of the community this year. We have gone to a lot of conferences and done a lot of presentations. Well, it says only 12 conferences, being all over the world at this point. We have had 8 government meetings, including with the provincial and federal government. We have 3 sponsors, and to date, we have received 0 public or grant funding. So all of that has been accomplished by 5 board members through 2025 and 3 new board members looking fresh and ready for 2026. All right. What does it look like? We look at the recap and we're like, oh, we did all that in a year. That's, I want none of the new board members to run away. No one run away. Okay, so one of the conferences that we attended was the International Lymphedema Framework. That's the one that happened in Niagara Falls. And we were invited there by the Canadian Lymphedema Framework. So we were really glad to be invited by them. But we also knew that it was really important that we go. There were going to be speakers at the ILF conference speaking on lipedema. And the speakers who had been chosen for this are sometimes known for being controversial and not always offering an opinion that's reflective of the lived experience of lipedema patients. And our job as the patient organization is to be in the spaces where we can't all stand and speak up for ourselves, and to offer the advocacy space and sometimes have uncomfortable conversations professionally on behalf of the lipedema community. While there were no patient representation or lived experience people speaking from the lipedema perspective, there were these other presenters. So Helen and I were there together, and we had an opportunity to go to the conference and see different vantage points. So what was your vantage point at the ILF conference?
When when I went to the conference, I was representing Lipedema Canada. I welcomed many, many lymphedema patients who were asking a lot of great questions. But what I really enjoyed about this conference is that I attended Obesity Canada earlier this year in Montreal, and everybody was asking me what lipedema was. But when we got to this conference now in the fall, people weren't asking me what lipedema was. And it was the same medical community or the same medical experience. People were asking, what can we do to help drive change? How can we help you advocate? What is your lived experience? How can I help my patients? So that was a huge change. And we're just talking about 6 months in the year. So for me, seeing that as a patient, because I don't have medical background, was really amazing. And I think the one thing that I really liked, and we were talking about these challenging conversations, I think it really hit home the patient advocacy part because the very last presentation, the doctor decided to change and forego what they were going to present and ask the medical community if we were to set up the ultimate lipedema system in Canada, what it would look like. And everybody drove these amazing ideas like treating pediatricians to start diagnosing at an early age, providing, the medical support, the medical treatments, providing surgeries that are going to be available in Canada. So everybody was thinking on the positive side of lipedema. And for me, that's not something that was available a year ago. There was a lot of controversy when that topic came up. And here we had 50 people in a room, all providing ideas on how to treat lipedema in Canada as a blue sky idea. And that for me was very hopeful. It brought me to tears, to be honest. And I was hopeful that, we are making small steps now, but we're going to be moving really fast in the next couple of years.
Absolutely. Yeah, speaking back to some of those conversations, when certain presenters were presenting their ideas, that we found that there was a lot of lipedema patients who were in the room, and providers from all over Canada, and all over the world, actually, at that conference. And a lot of them came up to Helen and I in the breaks, and they were asking, hey, I was just in a presentation and I heard some information that really doesn't track with what I've read about lipedema, and it's not tracking with my lived experience, but they were doctors. And I'm really confused. Can you help me understand? And I think it's important to identify that with all of the information we receive about lipedema, until the science is clear and we have definitive understandings of the disease pathology and the treatments that do effectively work and are proven by science, there will always be a space where there's a lot of debate. And sometimes that debate can be helpful, and sometimes from a patient perspective, it can feel harmful. And so we did have some conversations with clinicians where we stood up and challenged some of the ideas that the doctors were presenting, and asked them to fill in some of the blanks that we knew existed, like the existence of the lip leg study, and challenge some of the recommendations, like every lipedema patient was advised to have gastric bypass by one particular provider. And that just didn't seem to make a lot of sense. It didn't take into perspective all of the lived experiences of lipedema patients and our very complex health needs. So again, we put ourselves into that space. We used some creative methods, including creative t-shirts. Sometimes if you're not allowed to open your mouth and you're not given a space, sometimes you can wear what you're really thinking on your shirt and let it start conversations. So we did that, and we met some amazing people, and really found that there are lovely allies in the lymphedema community for the lipedema community, and we are really not as far removed as we might have thought at one point. So we're really looking forward to working more with the lymphedema communities. So before we get to the next topic, there's one more person we would love to introduce. They weren't able to join us tonight, but I want to turn it over to Reina to give you guys all some news that I think we can collectively agree we are very excited about. Reina?
Thank you. Thanks. So in addition to our ally, Dr. Buri Simon, we also have another physician joining our team. We're super excited to have these members join our executive as allies and also as very informed medical professionals, as we already heard, treating many patients already and bringing their expertise to our board. So Dr. Caitlin Sear from Manitoba, is a family medicine and obesity medicine specialist. And she is going to be joining our board as a newly found role as our medical director. And so I can't wait for you to meet her. She's super energetic, knowledgeable, passionate, small but fiery. um, and she was in Rome with us and brought some great energy and really bonded well with the members of the team that were there. And I look forward to her energy to the rest of the board and what she can offer to Lipedema Canada.
Absolutely. I don't know about you guys, but it's so exciting to have more medical professionals joining us on the board, knowing what we have ahead of us, which of course we're going to reveal to the audience tonight, but just knowing the scope of the work we have in 2026 and how important it is that we start diversifying these roles so that we can continue this incredible momentum that we have as an organization. Why don't we tell everybody about Rome, the great adventure that was Rome? The majority of the folks on the screen tonight were actually in Rome, including Dr. Delphine. So I want to make note that all of the directors from Lipedema Canada paid their own way to go to Rome. We felt that it was incredibly important to be present at the World Lipedema Congress. This was the second edition of the World Lipedema Congress, where clinicians and researchers, patient associations, and the top experts in the world on our condition gather to share their research, their insights, information, and to collaborate together. And we knew that even though we are a newer organization and funding may not be there, so we could send us all at cost, we all committed that this was something we wanted to do. So I just wanted to have full disclosure around that. And then let's dive into the highlights. So with so many of us there and so many things presented, I think it's important to start off by saying, I personally, and I'll ask Dr. Delphine and Reina for medical conferences, had you ever seen so much content at a conference, a medical conference, ever before? No. I think they told us one day that it was 77 presentations a day over 4 days, running 12 to 13 hours a day. So the amount of information that was coming at us, even with multiple people taking notes and taking photos and videos, our brains melted. So we needed a minute to come back and review what we've learned. So why don't we start it off? We're going to go a little bit out of order here. And so I'm going to go to Holly first. Holly, we identified that there was some sort of key topics. What was one of the key topics that you found was brought up a lot and was interesting? Can you tell us about it?
For me, it was GLP-1s because it is such a hot topic in our community, and it proved to be the same thing there. They had an entire morning dedicated to it, as well as some presentations the evening before and at scattered times. And a lot, there was a lot said, but not a lot said in a way. There were lots of interesting presentations, even some heated discussions around it, particularly around nutrition and the benefits of GLP-1s versus nutrition, things like that. Lots of surgeons said they do prescribe GLP-1s to support surgery, but there were also doctors who said they don't, recommended they don't prescribe it to their patients and things like that. But in terms of research, there were surgeons, doctors, researchers that reported on what they were seeing within their own practices, but there were no large scale studies done, scientific studies done yet, although Lipedema Foundation is very keen to do one and realizes that with lipedema patients that there needs to be research specific to lipedema patients and GLP-1s. And they are trying to engage Eli Lilly, but so far they have not been able to do that.
I want to ask Delphine. So, Dr. Delphine, were you present during the GLP-1 morning? Were you in that presentation as well?
was
what were your takeaways from that presentation? Lengthy
um
presentations.
yeah what I found was I think sometimes, even though on the whole, like the whole presentation were very informative and very useful, I think sometimes, sadly, it was a bit putting the blame on the patient too much sometimes. You know, like I don't think as professional, especially when you're presenting towards an audience that's mainly patients, you can't really blame patient too because, you know, like telling them, okay, this medication might help you, and we know it's safe, we know it's going to help you, but please stop eating carbs, do more sports. You know, I felt like it's not what I want to hear because I'm trying every day to tell not my colleagues, because my colleagues are actually thinking the same as me, but other professionals, other doctors, I'm trying to educate people not to say that to patients. And then you go to a conference where we're coming from the 4 sides of the world or 5 sides of the world, and you don't want to hear that. And I felt it was a bit too much and putting too much blame on the patient, and we didn't want to hear this. But I was glad that so many doctors and so many people who were presenting there, and people like you, Emma, who actually put that right the next day. That was good. And we have very, very good knowledgeable doctors working in different countries who actually believe that this drug and those medications are useful. But I think maybe, I don't know what was the screening process for those talks. I don't know what was vetted or not. But I think we need to be careful when we say something like this to like 700 people.
Very much agreed. Yeah, I couldn't have said it better myself. Um, I was so glad to see our Canadian doctors who were present stand up and take the mics. This is before you guys had become directors at Lipedema Canada, but you, all of you, yourself, Dr. Sear, Dr. Dejeuner, everybody took turns taking to the microphone to challenge what we had been hearing. And so, on behalf of lipedema patients, I just wanted to make sure that we acknowledged that we were incredibly proud and also incredibly grateful as a community to have that voice of advocacy in a room full of doctors. So thank you for being one of those people.
Thank you.
I want to say one thing that frustrated me in that conversation on GLP-1s was some of the doctors were saying, so like, we don't want to put the patients on a GLP-1 because that means that they're supposed to be on it for a lifetime. Like you wouldn't hold back blood pressure medication because they have to be on it for a lifetime. Like it was just a really frustrating conversation sometimes in the room.
I agree with you. Same with diabetes. So
Right.
any chronic disease anyway.
Yeah. Yeah, it's interesting. So, Reina, you're also a medical professional. Did you have that same frustration in listening to how people are talking about treatments related to lipedema and confounding it with obesity? Like, what did this trigger for you?
100%, as a person also with an eating disorder, full self-disclosure, to be blamed when, you know, um, many of our people have suffered long enough, and to have that kind of blame it was quite emotional actually, and to feel the power of many people actually coming up to us and coming up to our physicians, lipedema associations from all over the world gathering to say we're all on the same page. That was such huge strength in what the things that we do, the things that we're fighting for, are we're all actually on the same page, fighting the same fight. And I don't want to say fight, but really, like, we are all really pounding the pavement to be heard and seen, and to have our disease acknowledged, witnessed, and treated like any other disease. And the power of the community was fantastic. Yeah,
Yeah,
it was tough, and I left with hope though.
same. Yeah, absolutely. You touched on some really important things. Um, let's maybe go to you again here. So what was the other, there were a bunch of topics, sort of like, of all this content we could have filed them into, I think, probably five categories. So GLP-1s and nutrition was sort of one category. Treatment modalities, whether that's conservative management or newer treatment options or surgery, were all kind of in another. And then surgery was a big topic, obviously, and then there was advocacy components, and then there was new science, etc. So what was the topic for you that was like your zero in? What was the one?
Yeah, so I want to talk about surgery, and so the whole first half day pre-conference of the Congress was dedicated to surgery. There was lots of other discussions on other days, but that whole first morning was around surgeries, and so there was 7 surgeons from varying countries all over the world talking about their talking about and showing on video graphically. So it wasn't for the faint of heart. Uh, as a nurse, it didn't bother me. I was very excited, but it was graphic for people who are sensitive to that. But so demonstrating, discussing their techniques, various methodologies, and it went from, pre-operative, their assessments, to intraoperative, how they're conducting their surgeries, and talking about their post-operative protocols. And so then they also highlighted, sort of early stage 1 liposuctions up to mega liposuctions greater than 20 liters removed. They talked about PAL, power assisted liposuction, WAL, water assisted liposuction, different methodologies. There was a demonstration, again on video, around solely arm lipedema of the arm removal, arm lipedema arm reduction surgery, which was very hopeful. I had never seen that before. There was also discussion about, skin excision. Does that happen at the same time as a lipedema removal surgery, or after? So there was a whole thing about that. Again, just people sharing, physicians sharing their experiences, and their different techniques, uppers and lowers versus fronts and backs. And we even heard about one whole leg removal of lipedema and skin excision, and then in one surgery, and then another leg in a different surgery. I had never heard of that either. And then to also speak to, because there was patients from around the world, some patient who had experienced at least one of these. And so having spoken to someone who had just had one leg done and then another leg was very interesting, not just to hear the physician's technique, but to hear the patient's experience, and to be able to ask questions of them. It was, yeah, it was interesting, awe-inspiring, yeah, very hopeful and very informative. Again, lots of information, and no one technique stands out above the rest. They all have great rationales for doing what they're doing. And, my personal hope is that, people, if they're entertaining surgery, that people do the research that they need to do for their own specific needs.
Yeah, that makes sense. I mean, there isn't one best surgeon for all people, and there was so many different methods that were discussed. I thought one of the things that was really interesting in that surgery topic, which is something I actually had not seen presented on before. Did you guys catch our fellow doctor from Australia, Raymond Shaya, I believe is how I pronounce his name? And so this doctor from Australia, he specializes in hypermobile Ehlers-Danlos, hypermobile connections, and lipedema. So he has a really good understanding of mast cell, but also on the specifics about when is it appropriate to do the liposuction and a skin excision for a hypermobility patient. And he had a totally different perspective than what we'd heard previously. So whereas other doctors will say, let's do the debulking surgery first and then wait a year until things resolve and then go do a skin excision to allow the skin to bounce back. Dr. Shaya was talking about that in a patient with Ehlers-Danlos. there may not be a retraction of the skin, and that it might be worthwhile. And he is often in his practice doing the surgeries all in one. So just really interesting to see doctors at different intersections, all with lipedema in common, but with very different lenses on so many different things. We could talk about surgery forever. I know it's a huge topic. It definitely was at the conference. But I want to make sure we touch on all the different things we learned. So Angel, what did you observe from all the different conversations where they were talking about treatments? Because we heard a lot about different options for treating lipedema.
I think I'm going to talk about the research panel instead. We changed that.
I'm good with either.
There was so we talked about some of the frustrations that we experienced throughout the conference, just hearing different. It was interesting to hear different viewpoints, but also frustrating as a patient sometimes. But one thing that it really stood out to me was the end when Lipedema Foundation had a research panel discussion. And so it was a bunch of there was patient associations, there was just different people from throughout the community there. And it was sort of like, here's your opportunity to give your wish list of what you would like to see for research in the next couple of years surrounding lipedema. And so number one, obviously a cure, like how beautiful would that be? But really high up there was standardized tests. So like having blood work or some kind of imaging so that it's not just a clinical review and like going through your history and that kind of stuff. Just having a more precise standardized test would be great. More research on like the comorbidities or like co-occurring conditions like Ehlers-Danlos, hypermobility, and mast cell and POTS, and just all the different conditions that are often prevalent with lipedema, also like ADHD. GLP-1s, obviously that was a big topic, and I think Lipedema Foundation is already doing a little bit of research, and Holly had touched on that. It was just a huge list, and I did not make notes on it. I'm sure Lipedema Foundation will be doing some kind of summary on that. But it was just like, I felt like that was really hopeful and just super thankful for all the research that's happening. Like, I just feel like if you started following research on lipedema a couple of years ago, you would see the mass increase on what there is now. And having an organization like Lipedema Foundation, who is actively looking for new opportunities to research, was really exciting to hear.
Definitely. Someone's asking what the name of the Australian doctor was. To the best of my recollection, the pronunciation is Dr. Raymond Cheyenne Rami, or Ryan. Do I have it backwards? In my brain, it was two things.
Raina put it in the chat.
Brilliant. Raina, you're so on top of it. I love that.
It's Cheyenne Rami, I believe.
Rami.
First name. Last name Rami. Last name Cheyenne. First name Ramin.
Ramin, yeah. Also, the whole team from Australia was an absolute riot. We had so much fun with them. And if anyone saw our social media videos of us dancing with literally all of the top researchers, doctors, patient associations, I got to tell you, the one thing that the lipedema community knows how to do, they know how to do science, and they know how to do dance parties, because it was really fun. It was super fun. At the conference, I think the thing that I really latched onto was the opportunities for advocacy. So specifically, we were invited to speak officially. We had three presentations over the span of the conference. And the first presentation that I gave on behalf of Lipedema Canada was for the pre-conference and the Patient Association Roundtable, where we actually got to meet for the first time all of the other organizations, just like ours, in all of the different countries in the world. There were associations from Portugal, from France, multiple from France actually, from Italy, from Australia, from the UK, from Ireland, from Scotland. I could go on. And what was really incredible.
Don't forget Brazil.
And don't forget Brazil. They had a huge presence. Yeah. And the American Lipedema Association. There was a huge presence from the patient associations. And what was really incredible was that each of us had a different a different platform for advocacy, but there were similar notes running through. You know, a lot of us don't know a lot about other healthcare systems. We don't know what the struggles in other healthcare systems are, and learning that a lot of us are fighting for the same things, but by different rules. In some places, like in France, I was really taken at the fact that they can't publicly advertise health information, and they're effectively handcuffed about what they can advocate for, and so they're working within the confines of rules that are really challenging. They also have systems where some of their healthcare is funded publicly. So just really challenging. But where the advocacy part came in for us, obviously I spoke about what are the barriers in Canada, and I informed about, you know, where we're at as far as identifying the barriers, like a lack of a diagnostic code, a lack of standards of care. They don't teach lipedema in Canadian medical schools, so we're incredibly lucky to have doctors like Dr. Sear and Dr. Delphine, because it's they know about lipedema because they're passionate enough to educate and to go to places like Rome to learn more. But that's not everybody. So on the topic of the, you know, GLP-1s and whatnot, and as Delphine touched on, there was this blame of patients, and it was palpable. There was an energy when I walked into the room that day. People were upset. Doctors were upset. Patients were upset. The team was flustered. There was just this heat. And it didn't take more than a minute to realize that the heat was coming from exactly that, from this stating things we know about lipedema, like lipedema and obesity are two separate diseases that sometimes co-occur, but then immediately assigning the statement that, well, patients should be made to manage their diets more, because really managing their two chronic illnesses that are both not their fault in any way, they should just try harder. Or that we don't want to put lipedema patients on GLP-1s because then we'll just take them away after a couple of years and then they'll relapse. And as I'm seeing and palpating what's happening in the room, the entire Lipedema Canada team, doctors and all, we realized that we needed to change our presentation for the next day, which was going to speak to just a much more general topic. And we took the opportunity to take a platform of advocacy. So we stayed up together and we worked on what we call the Dear Doctor presentation. And it was a series of 8 things that we would like doctors to know from the patient perspective before they offer nutrition or lifestyle advice. And it was presented as nurses present in a way that is collaborative, but it was also very direct, and it felt a bit uncomfortable. Again, just like the ILF, sometimes you have to stand in the uncomfortable space to say the important thing. We had a presentation the next day, so the third one, where we took another advocacy opportunity, and this time we spoke to a really challenging problem that's occurring as progress is happening. So does everyone here in the room, Jess, you've heard about lip leg already?
Yes.
Yeah, okay. And so for anyone at home who doesn't know, lip leg is a randomized control trial that happened in Germany that just released its results, and it was looking at the effectiveness of lipedema reduction surgery as compared to just using conservative measures like MLD and compression. And the study results were so positive in showing that surgery is safe and effective, and meets the primary endpoint of reducing pain for lipedema patients, that it was scientifically stated that it's medically necessary and should be an insured service. And so Germany has, put it in place that they're going to cover it under the public healthcare system. But there's a big but here. They have put in a BMI restriction, a very strict BMI restriction, a restriction that we're seeing harmfully sort of being pushed across all lipedema platforms as a way to exclude patients from being able to access medically necessary care. So Delphine, were you present during a lot of these BMI conversations as well? Yeah. What was your takeaway from this restriction about a BMI of 32 was sort of like their high end?
What I gathered was it's mainly for like health cost, really.
Mm-hmm.
It's mainly for the government to actually make sure like it doesn't cost them too much money. we actually do that a lot in medicine, and it's not always justified for like safety or security reason. Most of the time, it's mainly to discriminate against patients. And we know it's absolutely absurd in lipedema because the BMI doesn't correlate at all with the disease. And it's not a question of fat. And also, compared to like, we actually do it for, I don't know, like for some, let's say, knee surgery. You're waiting to have a knee replacement and you're overweight, and your surgeon is going to tell you you need to lose some weight before you have your knee replacement because the anesthetic risk is too great or because the prosthesis is not going to hold properly. That actually could be valid if you're actually overweight, but it doesn't work in lipedema because you can't lose the weight. So you're actually punished. You're never going to get under your BMI of 32. So you're never going to get your surgery. So you're going to like be miserable and be in pain for the rest of your life. So that's not a valid medical or like scientific reason. It's mainly for healthcare issues, and could be also a way to make sure sometimes the hospital can actually operate in like a dual public and private system. Like if you're over the 32 BMI, like if you come from the United States or from Canada and your BMI is 37, you're going to get your surgery because you're going to pay for it. And it's not a health or a safety issue. It's mainly just a money issue.
Yeah. No, you covered it exactly. I mean, that was what was brought up against the BMI issue, is that in a room full of doctors who understand clearly that BMI, first off, isn't science, period. It's not, BMI is not a good metric for anyone. It was never meant to capture those assigned female at birth. It was made for men, and it's been proven not to be scientific. So the question was, why are we using it? Why is this an exclusion metric? And the answer we got back was that in the absence of another criteria that we can use more definitively to rule a patient in or rule a patient out, that plus the combination of waist to height ratio was going to be used. Now, this is off the cuff, and I just want to ask because, again, Dr. Delphine, we have our work cut out for us on the Lipedema Advisory Committee and moving forward as we work towards making policies and policy recommendations in Canada. How do we, and this, if you don't have an answer, that's okay, but I'm asking, how would you as a doctor and on the Lipedema Canada side, how do we approach challenging this so that that kind of restriction doesn't find its way into Canada as policies around surgery are going to be made?
It's a very difficult question. I don't think I have an answer for that, but what I would believe we could do is actually do a little bit more teaching to explain to people, like whatever, like politics or healthcare professional, that actually lipedema is not the same as being overweight, and it's not being fat.
Yeah.
And you can't actually get rid of this fat, like they say, without the surgery. So it's like you're going full circle, you know, you can't really, the people are not going to lose weight.
Yeah.
You can give the example of people taking GLP-1 and say, you know, you expect them to lose so many percentage of their weight, and actually doesn't work. You know, you can, I think we need a lot more education on what is lipedema for people to be able to understand that the BMI doesn't apply. And exactly like you said, we can also do a whole talk on what is BMI and why we should not use it anyway, you know. But
yeah, no, that's fair. Well, you and I and Irina and the doctors on our team, we will sit down and start strategizing this issue. But thank you guys all for your input to Rome. There will be more updates from Rome as we look through our camera rolls where we took pictures and videos. And we find articles that we'd like to highlight. We will write blogs, post them to our website, and also put them through our newsletter. And as new research comes out, we will be sharing stuff like that with you. And with the help of Dr. Delphine from the clinical education side, we'll be sharing that with as many Canadian clinicians as we can as well. So let's move into our next topic. Jess, I feel like because you weren't in Rome, we didn't get a chance to really involve you in that one so much. So I want to ask you, what kinds of things are you excited about working on for Lipedema Canada, and what inspired you to join us?
The inspiration for me, I'm brand new to the world of lipedema. I self-diagnosed, as many of us do, just recently in July, and have had a formal diagnosis in September of lipedema. And I've got 40 years of healthcare experience. And first thing I did, hit Google, start looking for information, and came across Lipedema Canada, which has been a wonderful resource for me, but was really quite dismayed at exactly what you've all presented. There's so much still to learn about lipedema. There's very, very few resources in place in Canada for lipedema patients. Simple things, funding for MLD, funding for compression, which we know are both very helpful, funding for surgeries, finding doctors to even provide us a diagnosis. Because I'm newly retired, I have time, and I've been looking for an opportunity to volunteer with an organization that I could be passionate about and work with a group of passionate people. And Lipedema Canada really, really stood out to me. And it's an opportunity to make a difference for ourselves, but also for the many, many women that we know are going to be coming up behind us. So I'm very, very excited to be here. My role right now is to be providing a series of blogs from a new patient diagnosis perspective and just sharing. And it's kind of a emotional relief for me too, because I'm still processing the anger, the dismay, all of the things about now living with a chronic disease and trying to put together a toolkit for moving forward. And I felt that that might be helpful for this community to be able to share all of that. So that's what I'm working on right now.
Thanks, Jess. Did you mention the other day that you found us? You actually, the first interaction you had with us was on our last fireside chat, like the one where
Yep,
we were.
yep. Yep, the last fireside chat and the conversation that you had about the lip leg study, that was extremely exciting to see peer-reviewed research coming across, like gold standard research talking about surgery versus conservative measures and outcomes for patients. And again, just feeling very upset and angry that those resources are not yet available for us here in Canada. And we've all got a lot of work ahead of us. And in that vein, with a lot of work ahead of us, we're asking for our community to continue writing letters to members of parliament, to their MLAs. We've seen some great response from our governments in response to those letters. We need to keep that pressure going. So please, the link will be on the YouTube video. The links are also going to be on Lipedema Canada, as well as templates in French and English if you need a little bit of help in crafting those letters.
Yeah. Holly, we've got the links available on our lip leg page. Is that correct? For all of the template letters are under there?
Yes, yeah, exactly. After we gave some information, as was mentioned at the fireside on lip leg, we put out a call into the community for letters to government and to try to advance the cause. And we did, as just mentioned, we did start hearing back. So I'd love for you guys to talk a little bit more about the government meetings, let everybody know what's been happening.
Sure. Yeah, we can do that. Angel, Reina, we have been in meetings with not just Manitoba. I just want to say out loud, I know Manitoba has had a lot of really great strides, and Angel and I are both from Manitoba, and so optically it might look like the only progress that's happening anywhere in the country is in Manitoba. That is not true. And I'm sorry we haven't done a great job telling you. But Angel, where else have we had meetings?
We have met, so Manitoba is the only government that we've met with the actual Minister of Health, but we have met with government officials, so the government bureaucrats, so the unelected people that are working in government in British Columbia, PEI, New Brunswick, and Nova Scotia. Is it?
Mm-hmm.
Yes.
Yeah,
And then
BC, Manitoba, yeah. BC, Manitoba, New Brunswick, PEI, Nova Scotia met with federal MPs.
Oh, right, not Nova Scotia provincial government. Yes.
Yeah, it was
so that's who
federal.
we met with so far.
Okay. Reina, so we're in on these meetings and we got organized. What are we talking to the government about? What are we asking for? Because in something as big as this, where do we start?
Yeah, so each meeting begins with a proper introduction to what lipedema is, who we are as Lipedema Canada, providing them information, and then we outline our goals. We want to talk about barriers. We want to talk about diagnostics. We want to talk about education to clinicians, standards of care. And so lack of formalized training to these clinicians. And so we come up with 3 asks. The first one is probably the easiest, which we hope, and we've had some traction. I'll let Angel fill us up on some of the answers shortly. But one is a day of recognition. And so Lipedema Awareness Day, we say is June 11th, and we hope that every province will acknowledge, formally announce and recognize June 11th as Lipedema Awareness Day to the community, to each province. The second ask is their recognition and partnership around the lack of diagnostic coding. I can get into a whole lot of detail, but we know that lipedema is not formally recognized, does not have a formal coding in any province's funding or clinician coding. And so we want them and we want their help to recognize that that as an and integrate the ICD coding. And then third, because we have no coding, because we cannot count how many people we have, we get miscoded and misdiagnosed as lymphedema, which, you know, has a whole myriad of you know, outfall that doesn't serve us. But because we have no coding, then we have no treatment. We have no conservative treatment. We have no surgical treatment, and we want them to help us get those as insured benefits. So things like MLD, manual lymphatic drainage, massages, which help symptom relief, compression, prescription compression, which you know, are vital to, again, symptom relief and surgery, of course. And our ask is, how are they going to help us resolve this for them to be insurable benefits? And so we're clear. We're clear about our asks, and the conversations have been positive, but we're really going to continue to hold them and circle back and continue the traction that we have.
Angel, what have we been hearing back as we go through the asks, asking for a day of recognition, asking for them to integrate the diagnostic code, and then saying, hey, you need to cover services like compression and MLD and surgery for lipedema patients? What's been the sort of overarching?
Yeah, because we haven't been meeting with the ministers of health, so it is the recognition day needs to go through a minister role. I think it's a private member's bill. So they've said that they will take it to their minister of health, and hopefully that will happen. But we will do a follow-up email within the next few weeks to the government members that we have met with. And then for the provinces that we have not met with, we'll send a letter to the Minister of Health directly for those provincial governments and asking them and letting them know that Manitoba has already done this. So hoping that that kind of gives them a little bit of a push. So we are hopeful in getting June 11th recognized. There will be more to come on June 11th events in the future. And so a lot of the other discussion that Raina was talking about, like MLD and compression coverage, it's really been quite resounding that we need the standard of care, because they're like, how can government say that this is something that needs to be covered when there's not even a standard of care on how to treat this condition? So it is sort of like a chicken and an egg situation. And it was really helpful meeting with the Minister of Health in Manitoba, so Minister Asagwara, because they are a nurse and so have a really good understanding of the health system, and really gave some great feedback on what that process looks like. It's a little bit frustrating that that is pushed back on a small not-for-profit to develop that standard of care. But that is something that now we have doctors on our board, and we have Emma and Raina, and that is definitely work that's going to be happening. I just want to say, like, every meeting that I'm in, I'm a CPA, so a professional accountant who works in healthcare. So I do always talk to them about the financial cost to the system. So we deserve healthcare. Just to be clear, we deserve equitable healthcare 100%. But I do try and soften the blow by saying that there are so many savings to the system by implementing these conservative treatments. And then also, once surgery is available in Canada, that, or not even available in Canada, once we can get to the point of surgeries being covered by our health systems, what those savings can be is, just like a lot of different areas. And if you're interested, we can chat about that later. But I do always try and soften the message. Like, this isn't all about new costs. There is a ton of cost savings to the health system, and just the public system in general, not just to the healthcare system, in implementing all of these coverage options.
100%. This is one of the great things about having people on the board who come from so many different intersections and have so many different understandings of different systems that we're trying to navigate through. Hollyhead, being a director of communications, she does this professionally. So knowing how to work through things like standards and how to approach when we need media coverage, we've got that. We have Raina, a mental health nurse, and coming from a newer diagnosed perspective. We have doctors on the board. Jess is a respiratory therapist and having years of experience in healthcare. Helen, Helen's one of our Swiss Army knives. Helen likes to say that she's just a general director, but she does all the jobs that no one else can do. And it's true. Helen has an incredibly diverse skill set. And what I love is that Helen brings this big heart, passionate perspective to our board, as well as a fun passion for baking and project managing. Sometimes we really work at looking after each other. And what I found in 2025 is that leaning on the team as we're trying to figure these things out has been a really incredible way for us to learn how to support each other as a board, but also as lipedema patients who really want to fix this. We want to fix all of this so badly. So just looking around this Christmas tree face of amazing people, I'm just feeling very grateful for all the different places that we come from and how we can work together with the community that's joined us tonight to actually make a difference. Everyone should know that healthcare is delivered provincially. And so we are seeing some comments going, what about my province? So here's what I can tell you. Members like yourselves, individuals, sent out letters to every province in Canada. And we got some email responses back. Correct me if I'm wrong. Did we hear from the Yukon? I thought we had at one point early on. No, I'm hallucinating. No. That's okay. I know just that
Alberta.
We did hear back from Alberta in an unsurprising but deeply disappointing turn of events. They simply just refused to meet with us. They said we're too busy and we don't want to.
And they were kind of like, we've got this. It's like,
yeah, that was sort of the message of the email. I remember reading it and going, do you? And then I don't know. So we haven't given up on Alberta. We have an incredible team of clinicians in Alberta. I got to say, as a highlight point, Alberta's given us incredible doctors like Dr. Sue Pedersen, Dr. Vijay Arcana, Dr. Michelle Tubman, all of whom who are advisors to Lipedema Canada or participate with Lipedema Canada. And there's so many amazing CLTs and providers out there. So Alberta, if you are tuning in right now, I know that you have a lot of healthcare stuff going on, but letters are going to help. You need to get loud in every province that you're in. If you're feeling like, oh, they said they had a meeting with my province, that's not an excuse not to continue to send letters. Every single one of us needs to participate in the space that we're in. Send your letters, send your emails, phone calls, owls, mail them something, whatever you got to do. We need to get loud in the space that we're in to get them to move forward. And a perfect example of the community helping us make something happen is on the federal government side. So one of our community members out in Nova Scotia previously worked in government and wanted to know if when I was going to be out in the East Coast, if I would meet with their member of parliament. And so I was able to go and have a lovely meeting with Nova Scotia member of parliament who listened to us for 2.5 hours really thoughtfully and said, hey, but healthcare is delivered provincially. How can I help? And we had said, we need the federal health minister and the federal government to care about this issue, because everyone is doing the chicken and egg thing that Angel talked about. Oh, well, the province is waiting for Health Canada to do something or for a standard to get made. And these things don't just materialize out of nowhere, otherwise they would have happened already. So we're very excited to let you know that we've had a great meeting with the federal government that has now led to what will be a follow-up with the Women's Caucus. And so more on that as things develop, but we are asking them in good consultation with the Member of Parliament that we met with to start funding a lipedema position. So there should be a research chair at a federal level who is looking at all of these barriers we've identified and starting to come up with solutions to start fixing them systemically. And even just from a public health and awareness campaign, if this becomes a budget issue for the federal government, it makes it more real for the provinces. And instead of just our voice, it becomes something that the federal government is saying, you need to take this seriously. So if you are ready, get your pen, get your computer, and get writing letters. Okay, dear Santa, also dear government. Okay.
And just because you may have sent one before doesn't mean you can't resend. Do it every week if you want to do it.
Yeah. Reminder.
Follow
take
up
out
with the
trash.
same email. Yeah.
Yes. Send it again. So.
And just wanted to make sure that everyone was aware that Lipedema Canada did send out letters to every single health minister across Canada. So a lot of the meetings that we've had so far is follow up to those letters that we sent, or it could be as a result of the letters that you sent in. But there has been contact with every single, or we've sent, but we didn't necessarily receive a response, but we have reached out to every province.
Yeah. And we'll continue to. Helen, why don't you talk to us about where we're at? We have a goal we're trying to reach for the end of 2025, just a few more days, weeks left.
Yeah, we're just a couple of weeks away till December 31st. So we've talked a lot throughout this presentation about different things that Lipedema Canada is doing. I think first and foremost, most of the work we do is on a volunteer basis. I say most of the work, all of the work we do is on a volunteer basis, but there is a cost to everything else. So the website and having the database available for the clinicians, hosting these sessions, the technology that's required, the mailing of the brochures, the printing of the brochures, all of that has a cost. So we are asking for donations. You know, we're going to be doing a donation drive periodically, but the most important one we have right now is for December 31st. We're trying to aim for $5,000. We have just under $2,000 raised so far. So any little bit you can contribute is greatly appreciated. We ask that you go to our lipedemacanada.org website, and from there click on the donate now button, because you know, there's different other locations where you may see it. Just for simplicity reasons, just go to our Lipedema Canada website and do that donation through there. Again, you know, a target of $5,000 for the end of this year, and we are already almost at $2,000. So if you can help and ask your community to help, it would be greatly appreciated.
Thank you so much.
So Emma, yeah, you want to take us into some exciting stuff for 2026?
And we do issue charitable tax receipts also, just to make sure that you're aware of that.
Yes. So we have been issuing for the last year. So tax receipts will go out automatically.
Yes. I forgot one of my really cool slides that I made, so I'm going to show it now because we can't miss this. So here is the map of where we've already had meetings and contacts, and the big pin obviously being our federal meeting. So let me tell you about more exciting things. I definitely want to get to some of the exciting announcements coming for 2026. So some of you may have seen that we are actually going to be working on hosting our very first LipCanCon, our Lipedema Canada Conference, in 2026. It'll be running on September 11th and 12th in Winnipeg, Manitoba. And it's going to be a conference unlike you've seen before, in that the key around our conference is the theme foundations. So we want to create an opportunity where not only patients, but also clinicians can come to this conference and learn everything they need to know to foundationally understand lipedema, its care, its treatment, and the assessments. And so we'll be bringing in clinicians from all around the world who are experts in lipedema to come and support our Canadian clinicians on basically learning all the things they need to learn. We have a ton of really exciting initiatives that I can't spill the beans on just yet, but as a patient, this is going to be where you are going to want to be. So it's in September in Manitoba. That is not a terrible time of year here. It's actually considered to be very nice, so please don't be scared. So for a lot of you, you may have put your name in to volunteer before, and we may not have been able to utilize you yet. If you think you would like to make the trip to Manitoba for the conference, we are looking for volunteers, in-person volunteers who will get a reduced rate at attending the conference. Will have an opportunity to view and participate with everything. So Helen, how can people get involved, and what if they've already signed up to volunteer before?
Perfect. So if you've already volunteered or signed up to volunteer, there's going to be an email that's going to go out early next year asking for your interest in attending the conference and volunteering at the conference. There's going to be some specific roles and tasks that we're going to be looking for, so stay tuned for that email. But if you're new and you haven't volunteered or signed up yet and you wish to volunteer, please go to our Lipedema Canada website, and the address is on the screen right now. But if you go to our Lipedema Canada website, you'll find a volunteer or how to get involved. And when you sign up, there's an extra box where you can add additional comments. Please note that you're interested in volunteering for the Winnipeg conference. So we are looking for patients or people, volunteers that are interested in Winnipeg or anywhere in the Manitoba region, or if you're coming from out of town and planning on attending the conference and willing to support and volunteer in specific tasks, we're more than happy to connect with you and see how we can best partner up and make this the most successful conference in lipedema.
Amazing. Thank you so much, Helen. At the conference, we are working on doing some things like starting the Canadian standard of care with the help of interested clinicians. So if you are tuning in and you are a physiotherapist, a nurse, a doctor, a dietitian, a surgeon in Canada, and you are interested in the topic of lipedema and might be willing to participate in just such an incredible document, I would ask that you reach out to info@lipedemacanada.org, and we will put you in touch with our medical director and director of clinical education who will be helping us facilitate that work. There is other incredible work, which I can't get to right now, but I promise we're going to do a conference breakdown. That website is going to go live in early January, and we'll be taking in abstracts from professionals who would like to present. And then there'll be more information on how you can register and participate and join us. It's going to be incredible. Also on the list of things that are incredible, we had been waiting for quite some time to give you this announcement, but we made it official while we were in Rome. Lipedema Canada has been officially welcomed to join the Lipedema World Alliance. The Lipedema World Alliance is a group of organizations from all around the world who represent lipedema patients. They're founded by Dr. Herbst, Dr. Gods, and Dr. Michelini at the top there, and directors from Lipedema UK are also on that board, and Italy and Portugal, and so it's a really incredible group. The American Lipedema Association is part of them as well, and now we are proud to say that Lipedema Canada is also a member of the LWA. So that is very exciting, and we are looking forward to other partnerships with lipedema and lymphedema associations as the year goes on. So the last thing, because we're at our end time, but I just want to go back to the team here, and let's just ask, were there any burning questions that Helen, you've been moderating for us, and I can pull them forward, but was there anything that you really wanted me to grab and pull forward, and maybe we can answer? Let's do 3 questions total, and then we'll say goodnight for the night.
Yes, absolutely. The main question was, where can I find a clinician? So again, I've responded to everybody, but in case you don't know, if you're looking for support in your province or in your area, it's important you go through the Lipedema Canada website, and under patients, there's a directory where you can look for your local area. There is a question. Give me a second. Do you want me to read them, Emma, or just put them in the group chat?
Oh, no, you're good. Why don't you go ahead and read one? I'll see if I can find it as we go.
Okay, so I joined a bit too late, and somebody was asking if there's a definitive nutrition regimen that was portrayed as being effective in inflammation reduction for most persons with lipedema, or is it still subjective and varies from individual to individual?
I could answer this, but I'm going to turn this one to Dr. Simon. Were you in the session where they were talking about the nutrition and the recommendations back and forth?
There is proof that some actually diet could actually help with inflammation and help with lipedema. But we have to be very careful when we talk about diet, because we don't want this to be like completely like to exclude some nutriments and to, like we said, the blame of the patient, like your lipedema is going to get so much worse if you actually do something different. But there is some evidence that if you actually do like a low, like you use a keto diet, for example, it could help, but it's not going to get rid of your lipedema. So that's very important. It's going to make you feel better, but it can help with a lot of different diseases as well. There is a lot of information actually on our website, and there are actually a lot of studies. So I would tell people to actually look at the website, and also to be careful, because we can't actually say to someone, do the keto diet, because lipedema might not be the only medical problem. So that's very important to actually find a clinician, and it doesn't have to be a doctor. You can find a dietitian, you can talk to your physiotherapist who's very knowledgeable in lipedema, and they can actually give you advice. But it's very important to look at the person, on the whole person altogether, not just like what you eat.
Brilliant. I'm very excited for the update to our website, which will include the help from our new clinicians on the board as well, and then reaching out to some of our clinicians across the country who we use as medical advisors to help fill that information out even more in 2026. I'm really very excited about putting those resources together, including stuff that Dr. Borisman has already sent to me. So we're gonna get some things put together for you. Helen, the last question, was there any in French that you wanted to answer?
Yes. Well, it was in French. I'll translate it to English, and then we can provide the written answer in French as well. But is there an idea of when they'll have insurance coverage for surgery in Canada? But even if you have to go out of country, so that Canada will cover out of country surgeries. So do we have an idea of when this would or could become available?
Jess, do you want to answer this one?
Right now, no, we don't. We've got a lot of ground to cover. The best people have been able to do is to claim your costs for surgery on your taxes. There's good resources on, again, our Lipedema Canada website as far as documents that you need to keep track of. Unfortunately, that tax credit does not touch the overall cost of the surgeries. It's something that is very, very lacking in our country right now.
Yeah. And it's something we're working very directly to address. Now, we did talk about LipLeg before, and we do know that LipLeg provides us with the randomized control trial evidence that we need to challenge the government's the provincial government's current refusal in pretty much every province to cover lipedema surgery as a standard inclusion. It has been covered on case-by-case basis. We're not going to pretend that it hasn't. We know of patients who've been covered in Manitoba, in British Columbia, and in Nova Scotia for sure. And there are ongoing cases in many other provinces. And at some point, somebody is going to make progress and win. And the research supports us, but the timeline is just far behind right now. So yeah, like Jess said, we don't have a deadline. Yesterday would have been too late for a lot of us. So we will continue to work on this and continue to fight this good fight. I want to thank you guys all, my team here. Thank you guys all for giving your time tonight so we could come together and share this, Goliath amount of work that we take on every year. So thank you to each of you. I hope that you guys have a restful holiday season, and then we will get jacked up and just do it all over again starting in January. And welcome again to Jess, to Dr. Simon, and to Dr. Sear, who is watching us from afar right now and sends her kind congratulations to the introduction we gave. And she's very excited to share with you as well. So thank you on behalf of the Board of Lipedema Canada. I'm going to play us to outro. And if you guys have more questions, send them to our inbox either on Facebook, drop a comment in the YouTube, or email us at info@lipedemacanada.org. It has been a pleasure, and everyone take care and good night.
Bye.